Okay, well, we can go ahead and get started. Welcome, everyone. We're so glad you're here. This is an informational webinar about NASHP's upcoming learning collaborative on building linkages between public health and the healthcare system. We are really thrilled to offer this opportunity to states on building linkages between public health and the healthcare system as part of our public health modernization efforts. We're also so glad that you could join us today. In the interest of time, we'll skip introductions, but if you don't mind just weighing in on the chat and introducing yourself and letting us know you're here, we'd appreciate that. Please feel free to use the chat throughout the webinar if you have questions. I'm just going to go through, provide a little bit of additional information about the project and what it entails. And then provide some information on the application process, and then we can happy to go through any questions you all might have. So we can go to the first slide. Great. So hopefully many of you are already familiar with NASHP, but if you're not, we are a nonprofit organization that assists state policymakers in implementing innovative solutions to health policy challenges. We do this by convening state leaders to solve problems and share solutions, conducting policy analysis and research, disseminating information on state policies and programs, and providing technical assistance to states. We are not a membership organization. We have an actual academy of state policymakers who help guide our work on really a range of issues and represent a range of agencies and branches across state government. And we think this really helps strengthen an interdisciplinary approach that is really essential to state policy, health policy issues. Go to the next slide. The project team, we've got a great public health modernization project team here. If I didn't introduce myself already, I'm Katie Green. I'm the director working on public health issues. We're overseen by Sandra Wilkness, who's our senior director for public health, population and public health. Shelley Fiskus, who's a senior consultant on the project, and Ella Roth, who's the research analyst and many of you have heard from already. And we're also really thrilled to be joined by a policy analyst who will be joining us soon, that is coming to us from the New Mexico Department of Health and the CDC Foundation. Next slide. So in terms of the project itself, the goal is really to support state policymakers in modernizing public health systems by improving cross-sector alignment, coordination, and collaboration between public health and health system stakeholders. And we're thinking about that broadly in terms of Medicaid, commercial payers, health systems, community clinics, CVOs, really the whole spectrum of folks that really we need to be working together really to address key public health goals. The project is really going to unfold in three phases. The first phase we've really already completed. We had a wide range of conversations and informational interviews with public health experts, with health system experts, with many state leaders, and convened actually a really great state leaders working group committee to really provide us with some good input on where are the challenges, where are the opportunities, and what are some examples where states have really been able to make some exciting progress. We are in the process of developing an implementation toolkit for public health modernization, really focusing on issues around coordination, financing, data sharing, and then community engagement. And then, as you all know, we'll be launching a really exciting 12-month learning collaborative, which will provide learning opportunities and technical assistance for up to 5 state teams. Next slide. So in terms of what's really guiding this project and why we think it's important and exciting, as I said, we had a lot of conversations with public health leaders out there, and one thing that's really clear is that there's been a lot of important thought about the future of the public health system, and it's a conversation that's going on in many states. We have the bipartisan policy, the BPC recommendations, we have the National Public Health Commission recommendations, we have Public Health 3.0. We have all of these things to build off of, But really, I think a common theme throughout them is really building collaboration between public health and the health system. So what we really want to do is provide tangible, actionable strategies for de-siloing public health, as we've been calling it, and really aligning health system and public health experts around common priorities. I think one thing that we've heard throughout is that, and this is a very common experience, but if you've seen one state, you've seen one state, and that's especially true when it comes to different governance structures in public health, different constraints, resources, healthcare ecosystems. There's really not going to be any one size fits all here. So we want to identify really practical strategies that might be able to work across a range of states. We really want to make sure that we're embedding equity as a cross-cutting principle, and then really figuring out how to align and build on the work of partner organizations like ASTO, like NACHO, like 21C that are doing this work. And again, I think where we think it's really important is to what are areas of collaboration between Medicaid and public health? How are you working with health systems? So next slide. In terms of what this actually looks like, when I say public health and health system collaboration, I think where we might really point you to is sort of, if you think of the public health 3.0 buckets of prevention, really what's in that bucket two? What are some of those high priority, high cost health conditions that can really benefit from coordinated action on a federal level, thinking in terms of CDC's 618 initiative, which brought together Medicaid and payers and public health around really proven interventions to address high cost diseases, and then also the High Five initiative, but many great examples, which we'll drill into in the toolkit around state health improvement plans, alignment with community benefit activities, and really actually some of the innovations that have popped up around COVID-19 and those partnerships, and how do you think about deepening those connections to communities and really expanding and sustaining them into the future. Next slide. So this is a little bit of a sneak peek at our toolkit, and I won't draw down into any of these, but did want to provide you all with just a little bit of granularity about how we're thinking about this in terms of key steps for developing those relationships. How are you thinking about identifying partners and aligning priorities? How do you augment and really engage partners at a community level from concept to implementation? How do you build and sustain those partnerships and capacity? And then kind of what are the key steps for building and facilitating those partnerships moving forward? So how do you bridge communication divides? What are some really key opportunities and great examples that states have led around really priority issues like maternal and child health or COVID response or overdose prevention? A lot of thinking around improving information exchange and sort of what are key priorities in the immediate term as we're thinking longer term about data modernization and making those investments. And then finally, working within the Medicaid program and across payers to really align on key priorities and align incentives and thinking about some of those tools. So much more there, but I'll leave that for now. We'll go to the next slide and just talk about sort of the learning collaborative and what we hope to achieve. So as we said, this is really the learning collaborative will assist states as they're thinking about developing or strengthening policies or strategies to improve cross-sector alignment, coordination, collaboration. We hope to be really a resource and convener to help policymakers connect with peers and experts and provide targeted support based on your goals. NASHP will work with selected states to develop work plans and provide monthly technical assistance. We'll also develop collaborative learning opportunities, virtual meetings where you'll have the option to connect with each other. And all the way at the bottom, but I think I would underscore this particular point. We are allowing state teams with the option to hold an in-state workshop. So we can come, we can facilitate planning sessions, we can bring in stakeholders, really whatever might be most useful for advancing your goals. So next slide. In terms of the team composition and how this will work, we can support up to 5 state teams that'll be participated on the basis of your application to be supported through NASHP and participate in this opportunity. State teams will consist of up to 5 members, and we'd like to see representation from public health agencies and Medicaid in particular, with decision-making authority in those respective agencies. But beyond that, there are a great, this is a great cross-sector, multidisciplinary initiative, and we'd invite you to really bring in whoever might be able to support your state goals, whether that's legislators, whether that's someone in the governor's office, local public health leads, informatics, DEI, community engagement folks. Would really sort of leave it to you what the right composition of your team is to really work on issues that are most pressing for your state. In terms of just key dates, applications are due September 16th. That's when they're due to NASHP by COP. We will announce selected states the week of September 26th. And then we want to kick off the work in October. And we do know that there's a small matter of elections in many states. So we do want to be sort of flexible around your state and your needs. But hopefully in the month of October and November, we would spend some individual time with you all, really just learning about what you're hoping to achieve, your existing infrastructure and challenges, and then really sort of pinpointing opportunities and talking through how to get you where you want to be in the next 12 months. And then would love to bring everyone together for a virtual meeting in early December. So next slide. I think we largely covered this already. 12 months of strategic planning assistance and technical support. What that means is we are happy to do research, find out how other states have approached issues, sort of draw on our collective expertise and network of experts, really to support you in your goals and support you with a state-specific action plan. And then again, I think the in-state workshop is a really great option to sort of bring in a wider group to talk about where to go from here. And we can do that at your convenience. Next slide. All right, so hopefully you all have the application materials. We can drop that in the chat, that link in the chat as well. Fairly straightforward. We do not want this to be a huge lift for you all. Asking you to complete the application form and a narrative, which should be about 3 to 5 pages, really covering some of your existing efforts, your challenges, and some initial thoughts on what you all hope to achieve. Optional, you can provide letters of support from either your health leadership or governor's office, or if community engagement and work with community groups is a big facet of that, would consider letters of support from community groups. But again, this is not required, just if you want to include it in your application. Many states have chosen to do so. So next slide. I think that might be it in terms of information that we were planning on uncovering, but would open it up for any questions that you all might have. I can look in the chat to see if anybody has raised anything as either. All right. Any questions that folks want to raise? All right. Well, Sandra, any closing thoughts on your end, or additional things you might want to share with the group? Okay. Oh, it looks like we might have had a question. Oh, Sandra says no. Okay. All right. I will, one final chance for any questions, and also please feel free to email myself or Ella or anybody on the team if you run across anything as you're filling out your application.
And I'll just mention that I can share our slides and the recording of the session via email, and we'll be posting it on our website as well.
Awesome. Okay, well, I know you're all busy people. I don't want to keep you for any longer than we need to, but again, we're really excited about this opportunity. We hope you are too, and we'll really look forward to seeing those applications and hopefully working with you all over the course of the year. Okay, have a question. How do you define modernization, and what are the scopes of projects that you anticipate? So I think one of the things that we've sort of kept at the forefront of our mind in this project is just how broad modernization is in terms of scope. I know for some people it means sort of what are the nuts and bolts of workforce, of data, of public health governance that I think we're all thinking about. You know, and I would sort of harken back to some of those reports and frameworks that I mentioned in terms of what are real priorities for the public health system moving forward, and what does a modern, agile, flexible public health system that we want to work towards really look like. And you know, I think the COVID pandemic, you know, obviously not saying anything anybody doesn't know, revealed some real fractures and weaknesses. And one of those weaknesses was, you know, not only sort of how antiquated some of our systems are and where there's a lack of capacity, but really the need that I think the point that public health can't do this alone. And so, like I said, there have been, I think, some really interesting and promising examples of states figuring out how to share infrastructure with healthcare partners, how to collaborate with Medicaid as a major payer, not only to share information, but to incentivize public health goals. You know, some of this is also happening at the community level. Really a recognition of the importance of community groups in terms of connecting to those communities, and the need to really how to integrate those into policymaking processes. You know, from implementation to evaluation. So I've laid out a lot of really broad things. And I think the reason it is broad is because states have developed such a range of approaches. There's no way to do this. So you might be doing it through a SHP, you might be doing it through public health transformation. There might be sort of governor-led initiatives. So all of this is really sort of in bounds. And I think, you know, what we hope we can do is bring the right people together at the table to help work out what those priorities are and how to move forward. So that was a very long answer, but hopefully it made sense. All right, any final questions? Okay, wonderful. Well, again, please do reach out to us if we can answer any questions, and we'll look forward to seeing you all soon.